Because we believe. Because life-saving discovery happens here. Because the unsolvable is invitation enough. Why are we driven to discover? Because we can change the course of history. We can discover what is yet undiscovered. Because the world looks to us for help mending hearts. The Lillahai Heart Institute at the University of Minnesota is world-renowned for its extraordinary breakthroughs in cardiovascular medicine. In the past 50 years, we've performed the world's first successful open heart surgery, introduced the first wearable cardiac pacemaker, pioneered the mechanical heart valve, and performed the first successful Minnesota heart transplant. Because more than 700 heart transplants later, we're still innovating. In addition to our acclaimed heart transplant program, we're a national leader in implanting heart assist devices too. When 28-year-old Geoffrey Duvel came to us, he needed both. With his heart damaged by childhood chemotherapy, Geoffrey required a heart transplant to save his life, but he had to wait for a match. So we implanted a mechanical pump to ward off heart failure. We were one of the first to use this bridging technique to extend the lives of patients waiting for donor hearts. When a match was found 2 years later, we performed the transplant. And today, Geoffrey is back to an active lifestyle. Inspired by his experiences at the university, he's pursuing a career in medicine, helping others with heart disease. Because doctors here find ways to do what others can't. Becky Jean Brunner had always been an avid swimmer, but when she started having vision problems after her workouts, she knew something was wrong. A previously undiagnosed hole in her heart was causing blood to flow back in the wrong direction. She was told nothing could be done until she came to the University of Minnesota. What used to require open heart surgery and a lengthy recovery, our doctors achieved with minimally invasive surgery. Becky was completely healed in just 2 weeks and back home with her family planning their next camping trip. Because detecting risk early can mean a second chance. Brian Wenger has a special place in his heart for the university's Rasmussen Center for Cardiovascular Disease Prevention. The only one of its kind in the world, the center has developed the most advanced heart screening available anywhere. When Brian's tests at the Rasmussen Center signaled trouble in his mid-40s, he quickly got on a heart-healthy program. Now Brian advocates for heart screening in young adults, and he's grateful for the wake-up call that put him back on the right track so he can assure his 6 children that he'll be here for them. Because discovery is at the heart of all that we do. Innovating Lillahai Heart Institute scientists are advancing heart care in ways no one could have imagined even a few years ago. Dr. Joseph Metzger just invented a molecular Band-Aid. One day, doctors will be able to use it to mend weakened heart muscle with a simple injection instead of surgery. Dr. Doris Taylor surprised the world by creating the first beating heart in a laboratory, a discovery that will take organ transplantation in amazing new directions and may one day help solve the donor organ shortage. And Dr. Daniel Gehring, director of the Lillahai Heart Institute, is exploring the molecular networks that direct stem cells to form heart cells, both during organ development and following an injury. This work with stem cells could drastically reduce the incidence of heart failure and eliminate the need for heart transplants altogether, as a patient's own cells would be able to repair the heart damage. While these innovations are being perfected, right now doctors like Kenneth Liao are using new, highly developed surgical techniques to dramatically shorten recovery times for patients. Because we are transforming the future of heart care. The University of Minnesota is among the most sought-after destinations for advanced fellowships in cardiovascular medicine. We've trained hundreds of talented cardiologists, including 65% of those practicing in Minnesota. To continue attracting the best minds and to expand on our legacy of pace-setting discoveries in heart health, We're building a new heart center in the university's emerging biomedical discovery district. It will allow groundbreaking research, education, and cross-department collaboration to flourish. Because the next generation of cardiovascular leaders is in training now at the place where it all started, the University of Minnesota. Breakthroughs, answers, and all that once seemed impossible. At the University of Minnesota, we believe anything is possible. Because with your support, discoveries unfold, medical breakthroughs happen, and history is forever changed.